Thank you for the opportunity to present here today. No disclosures. So for hernia repairs, obesity is one of the major risk factors for complications and recurrence, and oftentimes surgeons have their BMI limits and prehabilitations for these patients beforehand. For these patients, one of the questions is, if they're at a certain BMI, is it better to proceed with surgery at an increased risk, or is there a role in terms of using bariatric surgery as a adjunct or as a bridge for hernia repair to better reduce that risk? There are currently no large studies out there that's looking at this. There are some smaller retrospective studies that examine this, and they say that there potentially can be a benefit. But this is a really difficult study to look at because hernias comes in all sizes, as well as bariatric surgery and obesity as well too. So we plan on using we did a large retrospective longitudinal study using a database to look at this effect. So we use a market scan database, and then we look at patients from 2000 to 2021 who underwent an elective ventral hernia repair and also had a 2-year continuous enrollment beforehand. And this is how we did our flow chart. Basically, patients with the 2-year continuous enrollment, we excluded any emergent repairs, and we separated into a bariatric group with a history of bariatric surgery within that 2 years and at least 90 days before their ventral hernia repair, and an obese control group where as if they did not have the bariatric surgery, but they did have an obesity diagnosis within 6 months of their ventral hernia repair. So we compared their baseline characteristics, and we used propensity score weighting to adjust for the confounders, as these are pretty different groups. So we look at the postoperative complications at 30 days and also hernia reoperations at 1, 3, and 5 years. So this is some of the baseline characteristics. We have about 10,000 patients that we looked at and 1,000 in the bariatric group. So as you can see, first off, the rate of obesity diagnosis between the group was significantly different to start with. And we purposely actually lead this out from the propensity score matching because looking at this, you can see that even with patients that had a bariatric surgery, they did not lose their obesity diagnosis, and this can potentially impact the result of their hernia operation as well too. And looking at their comorbidities, there was a significant reduction after propensity reduction differences after propensity weighting. And this is kind of the breakdown of the propensity weighting. There's still a few characteristics that are statistically significantly different afterwards, but looking at the standardized differences, they were not significant. And this is the 30-day postoperative complication operative characteristics. So you can see that in general, there are not that many differences between the two groups in terms of surgical site complications. But looking at incision drainage for hematoma seromas, it was actually higher in the bariatric group. And the rate of sepsis is actually higher in the obese group. And in general, bariatric group actually had a higher chance of having an adjunct procedure performed at the same time. And looking at the reoperative risk at 1, 3, and 5 years afterwards, it's interesting to see that bariatric group actually had a higher chance of reoperation at 1, 3, and 5 years afterwards, at 7% versus 5, 12 versus 9, and 14 versus 11. And this is kind of a surprising result that we found from this data. So looking at this, I think one of the things that to look at is why is this happening in terms of looking at this database. I think there may be some confounding factors that we're not addressing in terms of looking at patients with a history of bariatric surgery as a surrogate for using the bariatric surgery as a bridge. We cannot really find the indication why they had the bariatric surgery in the first place. We didn't really segregate or separate out the data in terms of what types of hernia repair they actually had, or based on the database, we cannot find the actual obesity in terms of significance of BMI differences between the two as well too. So some patients that had the bariatric surgery may have started out with a higher BMI, and after surgery, they were still at a higher BMI when compared to the obese cohort. And there may be a component that's nutrition as well too that can play the role in terms of bariatric surgery with malnutrition. So some of the limitations are just what I mentioned, and also is because of a database study over a long span of years. We did not really look at laparoscopic versus open repairs as well too, and that may play an effect. So in conclusion, looking at this database, I think bariatric surgery as a bridge for hernia repair there's a lot of nuance to it, and it's really complicated that, we should really look into more further studies to look at this effect and be cautious about using this as an adjunct where, it could potentially delay patient care. I'll be happy to take any questions.